with our WPRO region representatives and those of you who are able to attend. I want to start by wishing everyone a happy new year, as well as a happy Lunar New Year. We know that some of you are in the midst of celebrating this year of the rabbit, and we wish everyone really a wonderful, joyous new year. I'd also now like to start with introducing some of the special individuals who are on the call with us today. And the first are our board members. We have Dr. Lianhua Huang, our third vice president from the Taiwan Nurses Association. You saw Lian waving over there. We also have Professor Megumi Tashima from the Japanese Nursing Association. There's Megumi. And I still think we're waiting on, haven't seen yet, Dr. Alisi Talatoka Vudinwabola from the Fiji Nursing Association. Oh, she's there. Great, great. Hi, Alisi. Thank you for joining us. Okay. So, Sarah, you can go ahead and put the slide back up. I'm going to talk for just a few minutes. As you see from the agenda, I'm going to give some introductory comments, and then Howard Catton, our CEO, is also going to give some introductory comments. And then we have a number of our leaders from our national nursing associations in the region who are also going to provide some interventions and comments for us. And then we look forward to other comments that we can make available. So what I want to do is share with you that some of the things that we've been focusing on and developing. It's obviously no surprise that this last year, 2022, was still a very challenging year for all of us, all of healthcare, and certainly for ICN. But at the same time, I believe we have accomplished a great deal, and we're really looking forward to the work we're going to do in 2023, which I'll talk about in just a few minutes. But if we think back to some of the priorities that we've been working on, hopefully many of you participated in the Triad meeting. And as you know, our focus has been on implementation of the strategic directions for nursing and midwifery. These are really important goals for us to come together and continue to look at the investments that are needed for nursing across those four areas that are highlighted in the report, which are jobs, leadership, service delivery, and education. We know embedded in much of that also are our workforce shortages, everything from the working conditions of nurses and really advocating for better protections and addressing the mental health of nurses that we know has only become even more difficult because of the pandemic. Also decent pay and working conditions, continuing to focus on gender equality, respecting the rights of our marginalized groups, so really focusing on policies for diversity, equity, inclusion, and belonging, and making sure that we're also paying attention to the social determinants of health for all people and health equity. Our humanitarian responses, which I believe Howard might touch on, are also things that have been really important as we've seen changes in our world, not only because of the aggression and conflict in places like Ukraine, but also a number of other countries where there is conflict and where there have been natural disasters. And then also we know that our ultimate goal is to impact global health. So we continue to focus on the activities that we come together across all of our national nursing associations to make sure that all of our efforts really are focused on strengthening the workforce, moving the profession forward with the ultimate goal of influencing policy and practice to improve global health. So let me also tell you a few things about the year ahead for 2023 that we're now just embarking on. And Cyril, if you go to the next slide, one of the activities that I've had the privilege of taking part in is the UHC 2030 group, which is a group of individuals on a task force that has been put together and sponsored by the World Health Organization and the World Bank. Our goal is to be able to have an action agenda that is moved forward to the United Nations high-level meeting that will occur in September of this year. As all of you know and have been working on in your own countries, universal health coverage has been a critical element of improving global health for some time, with very specific goals for 2030. You may recall that the major agenda for and commitment to UHC 2030 was made in the year 2019, but we also know that we have really suffered some setbacks and delays in being able to improve universal health coverage so that people get the quality care they need when they need it, and also that they don't suffer great financial risk. We actually just did issue the draft action agenda about a week and a half or 2 weeks ago. There are 8 action areas, and I had the privilege to participate in a webinar where we shared those. And you've probably seen our press release, and we'll continue to share information about this. But essentially, what we know are the 8 areas, and they start with political leadership to champion UHC as a national priority. This is absolutely critical because this is where it starts the ball rolling for investments in all of the areas. The second area is leave no one behind. So we're talking about making sure vulnerable groups are addressed, enabling laws and regulation, and that's about an essential health benefits package. The fourth area is one that's really important to us, and that's strengthening the health and care workforce. And we've been very involved in helping to craft those recommendation statements, not only making sure we're talking about increasing the number and the retention and the quality of the workforce, but also embracing innovation and new models of care, particularly those led by nurses and midwives and other practitioners. The fifth area is investing more and investing better. Again, fundamental to how we will move this agenda forward. So that'll be part of our major strategies this coming year. The last 3 are move together toward UHC so that we are inviting all stakeholders to the discussion. Next is guaranteeing gender equality, which has been part of our major agenda. And then the last is connecting universal health coverage to health security. So you'll be able to read more about those and the work that ICN has been doing. Next slide, please, Cyril. When we think about where we're headed this year, and you've heard a little bit about this, but one of the key aspects of our work, again, is really to support our nursing workforce, to be able to look at the changes that have happened during the pandemic. And now our response for a hopefully truly post-pandemic world is for us to make sure that we've learned the lessons and we've internalized what we needed to know about how nursing can respond in a pandemic and how we want to make sure that we don't repeat some of the shortcomings that we saw. And so what we know happened is that nurses were not valued. Nurses were treated very poorly. Their workloads were enormous. The stress and fear and fatigue were unlike any other time. And coming out of this, we know that in almost every country, not only are we dealing with big shortages, but we're also dealing with a very disenfranchised nursing workforce who still want to feel valued. And so we have been calling for a new normal coming out of this pandemic. And that is a new status with appreciation and respect. We want nurses to be involved in decision making. We know they must have the resources, everything from the protections that are required from equipment and things like that, as well as other protection of risk, violence, and harm. And we've said over again, fair and equitable pay. Next slide. Yeah, so one of the exciting things, and you're beginning to get some information about the International Nurses Day this year, but we're taking that decision about really advocating for a new normal, and it's becoming part of the theme for our IND theme this year. And the new theme is our nurses, our future, which you see on the slide with the logo. What's going to accompany this for 2023, which we want to have as a year-long campaign, is a manifesto that will have a number of very clear directives so that all of the individuals that we interact with and our governments and our employers and our public is really encouraged and given the message that they really need to value, protect, respect, and invest in the world's nurses, because we know there can't be health or healthcare without nurses. Next slide. So that will be our work for the year as we pull together many of the strategic initiatives that we'll be working on, as well as revision of, or not revision, but actually, recreation of our next strategic plan that will be based on some of the great work we've been able to do. And so the last thing to mention, which of course is not a surprise to any of you, is the ICN Congress, as well as the CNR meeting that are coming up. The CNR will precede the Congress, so just before the 1st of July. But we hope all of you have registered Early bird registration for Congress is ending next week, the 31st. So please make sure that you have contacted your colleagues, give them one last push, make sure that they can get in the early bird rate. If not, we will certainly welcome them as we go forward. Okay, I'd like to turn things over to Howard Catton, our CEO, who's going to also give you a welcome and some updates.
Thank you very much, Madam President. And good morning, good afternoon, good evening to everyone. Happy New Year, happy Lunar New Year as well. There are a couple of people, just before I give my brief update, who I would also like to introduce. Firstly, Cyril, if we can bring forward and show David Stewart. David will be known to very many of you. David is our Deputy Chief Nursing Officer. He's based down in Australia, and David particularly, David covers lots of issues, but also is particularly available to support and connect with you in the WPRO region. David and Kylie, I believe it's also Australia Day, so happy Australia Day to you as well. And please do just say hello to everyone, David.
Hi everyone, and yes, it is Australia Day here, so thank you, Howard, for that. Look, I know many of you, and I've had a great opportunity to work with many of you over the last couple of years as we've worked on Congress and other areas. So it's been an absolute pleasure. This working group here that we've had in the WPRO region has been fantastic. And I also want to just give another shout out to Kylie, because she is the CEO of the Australian College of Nursing and has been fantastic in supporting both myself and also some of the regional work that we've done. So thank you, Howard.
David, thanks very much. The other person who I'm delighted has been able to join us this morning, and I just wanted to also to introduce to you, is Enrico Anzai. Enrico is the recently appointed, I know you haven't been in post long, Enrico, nurse lead for the WPRO region. We're very much looking forward to connecting more closely and working with you. I'm very, very happy that you were able to join with us this morning, Enrico. I will move on now and just give a brief update to follow on what the President has said about the work that we have been doing. Just to remind you, in terms of the workforce shortages, you'll remember that actually back in 2016, our then President Judith Shamian was involved in a high-level commission looking at health workforce shortage, and there was a predicted global shortage of 18 million healthcare workers. We looked specifically then in 2020 at the State of the World's Nursing Report, the situation for our profession, and using data available then, which, and important to note, was before the pandemic, identified the 6 million shortage globally, which you'll be very, very familiar with. We did some work at ICN with our colleagues from CGF&S to look specifically at nurses who were due to retire over the next few years. That number is nearly 5 million. So we know that we were facing close to 10 million replacement need for nurses globally. But as we all know, the pandemic has taken a huge toll on the physical and mental health of the global nursing workforce. We've monitored and described and reported on that COVID effect. And last year, our Sustain and Retain report included some modelling around what the impact of that might be in terms of numbers. And we thought that it could be that there are an additional 2 to 3 million nurses who could leave the workforce earlier than otherwise planned, putting us up to a 12 or 13 million shortage figure, which is, of course, is a huge number. There has been some work undertaken by other colleagues, the University of Washington's Institute of Health Metrics, who've also looked at the need for health workers around the world and nurses specifically. And they have taken a more ambitious measure of healthcare coverage to include more services. And when they raise the bar in that way, their figure for the nursing shortage is up to 30 million. So there is, we know this, there is a critical need to invest in both recruitment and the retention of the global nursing workforce. Next slide, please. Just this last week, colleagues, the President and I were able to brief the United Nations press corps on some of the key issues facing the current global nursing workforce, and a couple of issues that we specifically highlighted with them since that report, the Sustain and Retain report, were two things: that we had seen an increase in international migration, the recruitment of nurses from other countries around the world, and also an increase in strikes and disputes. In relation to international migration recruitment, colleagues, if you haven't already, you'll see from us that there was quite significant reporting of the comments that the President and I made about our concerns about international migration. There are 7 or 8 high-income countries who are really leading the way in terms of recruitment activities, and we're concerned about what the impacts are of that activity on some of our lower income countries. You'll be very familiar with the positions we've taken in support of the WHO code of practice, and we have reinforced that. You will, and as I said, you will see from us separately over the next few days what more we have been saying on those issues. But we also talked about the increase that we've seen in strikes, in disputes, and in demonstrations that have been taking place in every region of the world. And I think this is something that we are continuing to very closely monitor. Some themes that are clearly jumping out is that this is, without a doubt, a last resort measure by our colleagues in countries where they feel they have no other choice but to take this action in an attempt to try and get some movement and change from their governments and their leaders as well. But what's also striking, as well as addressing this years of historic underinvestment and undervaluing, colleagues taking action are making very, very clear that industrial action, back to the industrial action, thank you, Cyril, slide, is a patient safety issue. Things have reached such a critical point in terms of staffing that is at the heart of the disputes and the strike action that's been taken. And the other issue which we're seeing is a variation in the response and the reaction of governments to strike action and disputes. There have been some cases where whether it be employers or whether it be governments have moved fairly quickly to try and find a resolution, but equally there have been far too many cases that we're aware of where governments or employers are not entering into negotiations and not bringing nurses around the table, and the disputes are continuing as well. We'll continue to monitor and support our colleagues very closely, because the other issue that we have seen in some countries is governments looking at introducing new legislation and new laws to govern the ability of folk to exercise their right to take strike action. Next slide, please. So we know that there are these huge and enormous challenges, but we also know that this is a moment of opportunity for our profession, because we bring forward so many of the solutions to the health challenges and needs that the world is facing. And this project with the BBC, which I know you will have all heard about, Caring with Courage, is something that we've been and are incredibly proud to be associated with, because it brings forward these examples from right the way around the world of what nurses are doing right now to lead innovations in healthcare, to improve outreach and access to health services, to raise quality as well. And you'll be, if you haven't already, please do access the Caring for Courage website, look at the stories, the videos, use them in your advocacy, in your work with politicians and policy makers. And we very much hope that we'll be able to do, we will be doing more work with the BBC to bring forward these good practice examples. Next slide, please. So, colleagues, yes, it's a moment of challenge, but we do know that we have the World Health Organization. Dr. Tedros has been very, very clear about the centrality of nurses to global health and his support. In the next few days, probably as we speak, I think our new Chief Nursing Officer, Amelia, is on her way from your part of the world, colleagues, to take up her post to replace Elizabeth here at WHO. You've heard from the President very clearly about the ICN work not to return to the new normal, and how we will be taking that through in our International Nurses Day work from the 12th of May, but for the rest of this year and into next year as well. And we all know that the investment piece is going to be absolutely critical. The need to invest, but against a backdrop when we know that world economies are continuing to struggle. The war in Europe has had a huge and enormous impact that's spiraled into cost of living increases in very, very many places as well. And there is a huge need, as we know, to rebuild our health systems, which we firmly believe will be part of how we achieve economic growth. But it feels the investment argument is always important, but has never been more critical for us than it is now. So, colleagues, I hope that's a flavour of some of our work that we have been doing and where we are going now. And let me now turn it back to our President.
Thank you, Howard. And I think that I want to be sure that we also recognize that many of you have helped us in this work. You've been staying in touch with us, giving us examples of things that are happening, which is really important for us too, and also working within your own NNAs and countries in the region to be able to advance some of this work. So we thank you for that. I'm now very pleased to invite our 6 speakers who will again provide intervention and give us some updates, as well as perhaps let us know what challenges are going on before we have general discussion. So the first person I'd like to recognize is Kylie Ward. She is the CEO of the Australian College of Nursing and an adjunct professor. And so we welcome Kylie to go ahead and give her remarks. Could you please unmute?
Yeah, my apologies. New year. Thank you, Pamela and Howard, Dave, all of the team. It's great to see faces, and I'm even more excited that we'll get the human connection in Montreal. Australia is a rugged nation, and it seems for the last year, even before the pandemic, when we had Black Summer over the Christmas end of last year into this year, we've still seen more natural disasters of floods throughout the nation. So we're not without our challenges from a climate perspective, and certainly that is being coupled with significant workforce shortage challenges. The university sector going into the 2nd and 3rd year is seeing unprecedented lack of numbers in nursing applications. So it's the pipeline. I'm not sure if other nations are seeing that, but that is a concern with not as many people choosing to do nursing as reported through the Council of Deans of Nursing and Midwifery in many jurisdictions. So we don't only have the challenge now of reportedly, we're waiting for the Nursing and Midwifery Board to show the numbers. We're not sure if there'll be a net decrease in registration, or whether nurses have left work that are more experienced and senior. I'm hearing this from a lot of CEOs, and or have gone part-time. So what we have is new graduates. There's really not really any problem with new graduates getting employment. The aged care sector, a new government last year has opened up different opportunities for transition to practice programs and built on the previous government. So new graduate placement is strong. That still is a net deficit in recruitment, particularly with legislative changes into the aged care sector following a royal commission. So this government has now put in place there needs to be a registered nurse on every shift. And that's probably provided a gap of about 10,000 nurses across the nation. So I know that ICN was critical of Australia as one of those countries around skilled migration. It is a challenge. It will continue to be a challenge. We're certainly looking at the ethics around that from many different perspectives, but also retention, I think, is probably absolutely key, particularly of our senior or advanced workforce. And currently we're in, I've even done media over the last few days. We're about to go into a pretty big political debate and discussion to get nurses to have access in primary care to Medicare funding. And this government is looking to reform the funding model that will affect medicine and GPs. And so there's a little bit of turf war at the moment where they're saying that nurses shouldn't have access. We've all fought this for, it's decades old, but we've come back strong this year and united. And I think everyone in the nursing fraternity knows that we need to lead this in the nation. So let's hope the government's strong enough to actually make the changes and look at a more integrated model of primary care. That will then have a direct correlation to the presentations and the avoidable admissions to the acute sector. Like everywhere, nursing is needed everywhere, but in Australia, because of the vastness of our country, there's definitely disproportionate health outcomes and health equity for those living in regional, rural and remote, and we'll continue to tackle that. But I've probably gone over 3 minutes, so I'll close off now.
Thank you, Carrie. I think, highlighting some of these key issues, I am going to imagine we're going to hear some of these themes because we're hearing them already around the world. Everything from some of the natural disaster and climate change implications for health and health treatment, the workforce obviously being front and center. What you talked about in terms of improving care for the age sector does create a different kind of challenge too. And then I hope you're wildly successful as you pursue the ability to have funding for better presence of nurses delivering in primary care. Obviously, that's the fundamental strategy around universal health coverage, in addition to more investment. So thank you for detailing those and a few other items. And we look forward to hearing more about that. Thank you so much. Okay, next I'd like to welcome Philomena Talawadwa, who's the General Secretary of the Fiji Nursing Association. So Philomena, I know we had a note for you to join on as a panelist, and let me just, yes, I see you're up there. So Philomena, if you will put your camera on and go back to unmute, that would be great. We'd love to hear from you.
Sorry. Yeah. The feature.
We're having trouble hearing you. Let's try it. Go ahead and try again.
Can you hear me?
Now we can. It's a little scratchy sometimes. So why don't you try? Go ahead.
Oh, thank you. Yeah, I'm Philomena Talawadwa, and I represent. I'd just like to give a brief introduction about Fiji. We have 300 plus islands. Dominantly health medical services is government health services, but we have small private services. 4,000 nurses was the last count we had before the nurses started leaving in droves. We have 3 universities and 1 technical institution that provides basic nursing training. For us here, what we do new government leadership in 2020, late 2022. Prior to that, one of the main concerns we had to contributed to the many problems that drove nurses away, unfortunately. One was the salary anomalies and the salary, the non-payment of allowances like risk allowances, that and the shortage of working resources.
Philomena, I'm going to see maybe if you could go ahead and turn your camera off again, because we're having a lot of static with your voice. So we'll see if that makes it a little better. Go ahead, please. Thanks.
Can I give her my headset, Madam President? Can I just switch over to her? She can just use my, we're just sitting together in one room.
Oh, yeah, sure.
I'm sorry about that.
That's okay.
And then we have this lack of leadership with our nursing, or lack of leadership. They changed the structure. After 2020, the structure was changed in that our chief nurse was there as a chief nurse, but she knew nothing about what was happening because they changed the reporting relationships of our directors of nurses, and then it just trickled down to the fact that our other nursing, her subordinates were reporting to medical officers and other officers because of the command centers they had set up. And it had gotten so bad to a state that the chief nurse was not aware of what was actually happening with her nurses. And this is an issue of contention we've taken up with the new government in our last meeting with our minister, in the hope that the nursing structure that existed before the changes would be brought back, so we could have a demarcation of what was happening. The nurses make up 62% of the healthcare services here, but if they have a chief nurse and they do not report to the chief nurse, and that is really sad. And the last one was the brain drain and migration. Unfortunately, we are losing our middle managers and our very experienced nurses, and the new graduates will never ever be able to fill their shoes. We've had nurses who've just left the government institutions to work in the private institutions just because they offer a higher salary. Some, it's just a matter of $2,000 to $3,000, but for them, that was reason enough to leave. We've had nurses who have gone to Australia. Some of them are working as caregivers in the homes. And for them, they say that if the pay is better than what they're paid as nurses in the country, and if the working environment is conducive for them, then why not? They will go. And this is what we have to contend with right now. But it has never stopped us from taking our issues up to government. Unfortunately, with the previous government, to get an appointment to meet with them, let alone to get an email, them responding to emails sent to them was a non-issue. That would never happen. And what we've had to do was take our issues and concerns to the media. And that was the only platform we would speak out for what the nurses needed and speak out for what needed to be done. And even though we would we'd go back and forth with our leaders then, it never stopped us from continuing. The good news is this year, as soon as the new government came into power, it was in less than 3 weeks that our minister actually asked that the NNA, our FNA, go up to meet with him, as he wanted us to just sit and discuss on the best ways we could work together on the dire crisis that we have, and that is the shortage of nurses that we have right now. That's all from us. And we look forward to hearing what is in store throughout this meeting. Thank you.
Thank you so much, Philomena. And you really highlighted some of the key issues, starting with, what do you do when you have a leadership that can't perform for you, or you have difficult relationships with your government. I'm glad to hear your new minister has reached out to you, and that you didn't wait to pursue that political advocacy. And also recognizing that the migration issue that you've crystallized for us is exactly one of the problems that we're seeing as high-income countries are more attractive to individuals, whether they're actively recruiting those individuals or not. It is a loss of expertise. And as you're saying, it's compounded by individuals taking jobs that are not even at the professional level because the pay is more. So thank you for sharing that. Next, we will go to Dr. Toshiko Fukui, and who's the president of the Japanese Nursing Association. I'm so pleased to be able to welcome her. We were unable to see everyone live during the time we were in Korea, so we're happy to have you on the webinar today. So make sure you've activated your translation at the bottom of your screen too. Okay, we're not hearing the translation on the English channel. If someone can troubleshoot that for us.
We are not hearing I think there is a problem of microphone, because we are not hearing Dr. Toshiko Fukui, even on the normal channel.
Is it coming from, are the translator lines open? Okay, so Dr. Fukui, the translators are not hearing you. So do you have someone there who's checking to see how we can get your audio? Is there someone right there on the Japanese Nurses Association that can communicate with us from it? Okay.
Can you speak?
Uh-huh. Okay.
Okay.
Maybe while we're waiting, I'd like to remind everyone who's on the call, if you would like to ask a question, only the panelists are able to speak live, but please go to the bottom of your screen and use the Q&A function if you would like to put in a question. I don't think we're going to be able to translate them from Japanese, but hopefully we'll be able to have those questions come in English. While we're waiting, we'll give it just a little bit more time, and then we might need to just go on to one of our other speakers while we're still working on the audio from Dr. Fukui. Let's see. Is it possible that we can move on? That might be better for us to go ahead, and we will come back to Dr. Fukui. So next, let's go ahead and go to Dr. Liu Shi Chang, who's the Vice President of the Taiwan Nurses Association. We
Hi.
welcome her to our webinar. Let's see,
Okay,
Cyril,
thank
if you,
you.
yes, Cyril, if you would get her picture up.
Yes.
Okay, hello, everybody. Can you hear me?
Yes, we can.
Okay, thank you. I'm so happy to be here to join this webinar. Today is the 5th day of our lunar Happy New Year. This year is a rapid year. And the 5th day of the Lunar New Year is mean welcome the God of wealth. So it means today is a very good day to discussion of how we invest our nurses. We need more money. So I please the God of wealth can give us more money to invest in nursing in Taiwan. So, you know, Taiwan have still some nursing shortage, especially during the COVID-19 pandemic. Some of our new graduate nurses, they don't have enough the clinical practice hours. So some of the fresh nurses now in the clinical, they have some problem about the nursing skills. So we hope to providing some continued education to increase their clinical skill in order for the patient safety and in order to retention the graduate and new staff in the clinical area. And after pandemic, we still have the problem of nurse-patient ratio. Our government invest one project to develop some innovative strategy to solving our nursing shortage in Taiwan. So this project have suggested we need to have the enough nurse-patient ratio in the 2022. And in this year, in general, November, we have a meeting in Ministry of Health and Wellness and Welfare. Our minister hosted the conference, invited most of the clinical nurses and the NGO associations, the leaders in Taiwan, with discussion about the future patient-nurse ratio. We not only have the average day, the patient ratio, the regulation that we hosted since 2017, and we can reach the goal to the 2022. However, the nurses still not enough. So we need to increase the patient-nurse ratio in each shift. So we want to have the regulation in Taiwan to set up the each shift the regulation for each hospital in different level. So this is a new goal with which we can have the legislation, the nurses law in Taiwan until the 2025. And so the other issue is about the Aboriginal area and the offshore islands and some the rural area. So our government have already invested and funded 4 institutes to train the family nurse practitioners. We wish we have 24 nurse practitioners in the future. They can work in the rural area and to reach our goal about the universal health coverage. So we think in the manpower, TWNA, Taiwan Nurses Association, we cooperate with our government, not only the training the nurses and set up the patient nurses ratios, the regulation, and also invest some nursing education to increase the nurses can retention and in the clinical practice to keep our patient safety. And about the education, we still need to increase the level of our nurses in the clinical. As we know, the nurses with the advanced education, they can assume the more responsibility in healthcare and ensure the patient safety. So we wish all of the nurses in the clinical the entry level increased to 12 years. So we still have this goal, and we wish in the next few years we can have more than 70 nurses in the clinical. They have the BS degree and in the hospital. So most of our nurses in Taiwan, we still have a many campaign to increase the nursing education and continue education to provide our nurses have the competency to fight the pandemic. Thank you so much.
Thank you so much too. Appreciate you highlighting the issues, and first of all, starting with the God of wealth. So we're going to look to TWNA and success in Taiwan to be able to really bring these resources to bear. I think some of the common themes again is the advocacy with your ministry, as well as being assertive and taking action to pass laws that will change the regulation, change the ratio of nurses, with the goal of improving quality, improving the presence of nurses. Additionally, the advanced practice work that you talked about, increasing education so that you have not only nurse practitioners, but again, more highly educated nurses. And then also improving the continuing ed for your new graduates, for your younger entrants, for retention are all really important initiatives. So thank you for sharing those and some other items as well.
Thank you.
Okay, let's go back to Dr. Fukui from Japan and see if we've got good audio now. Dr. Fukui, are you already talking with us? Because I'm not hearing anything yet. Translators, are you hearing anything?
No, there's a problem on Mrs. Fukui's side.
So we're still not able to hear you, Dr. Fukui. It looks like we're still troubleshooting.
Okay.
すみません、聞こえてますか? Hello? Can
Yes,
you
we
hear
hear
us?
that. We hear that. Yes, we hear you.
よかったです。そしたらいいかな。
Okay, I think
大変申し
I think
訳あ
it's
りませ
working,
ん。こ
right?
ちらのトラブルで、同時通訳が難しいものですから、筑後にさせていただきます。
Apologies for the disruptions because of some of the connection issues. We are unable to deliver my speech through simultaneous translation. Therefore, I would like to do this in consecutive interpretation.
聞こえてますでしょうか?
Can you hear us?
Yes, we can hear you.
ありがとうございます。改めまして、日本看護協会福井でございます。2023年もどうぞよろしくお願いいたします。
Once again, my name is Fukui, the chairman of the Japan Nursing Association. I would like to look forward to 2023.
今日は発言の機会をいただきましてありがとうございます。
Thank you for this wonderful opportunity to speak to you today.
本日は SDNM に寄せて、日本の看護の状況と日本看護協会の取り組み方針について直近の状況をお話しさせていただきます。
Now, in the context of SDN, I'd like to briefly talk about the most recent situation of the nursing in Japan and the policies that the Japan Nursing Association is working on.
質の高い医療サービス、看護サービス提供の保障には、看護労働力として定着、維持することが必要であることは、パメラ会長からも述べられました。
As CEO Pamela said, the President Pamela said, in order to guarantee the provision of the quality medical and nursing services, we need to retain and keep the nursing workforce in place.
このためには、看護職の専門職としての役割、責務が正当に評価されて、それに見合う賃金が支払われることが欠かせません。
To this end, it is essential that the professional roles and responsibilities of nurses be fairly evaluated and commensurate wages be paid.
日本の看護職の賃金水準は、当初は全産業平均よりも高めです。
In Japan, the wage level for nurses is initially higher than the average for all other industries.
しかし30代以降には逆転します。
But the situation reverses after they reach their 30s.
就業者が最も多い40代前半の看護職と全産業平均では約7万円の開きがあります。
In the early 40s, the age group, which the largest number of nurses belongs to, there's a wide gap of approximately 70,000 yen in wages between nurses versus all other industries.
以降、この差が拡大していきます。
And this gap widens thereafter.
看護職以外の医療職と比較しても、看護職の賃金は低い傾向にあります。
Compared to other healthcare professions than nurses, wages for nurses tend to be low.
このような現状に対し、働き続けるためには仕事に見合った賃金が必要だ。給与が仕事量や責任に見合っていないという看護職の声も非常に大きいです。
In response to this situation, many nurses say that they need to be paid commensurate with their work in order to continue working, and that their salaries are not commensurate with their workload and responsibilities.
今回では、かねてより特にキャリアと連動した賃金モデルを提唱してきました。
The Japan Nurses Association has long advocated a wage model that is specifically linked to career advancement.
このような中、岸田内閣の下で看護職員の処遇改善が表明されました。
Under these circumstances, the Kishida cabinet announced an improvement in the treatment of nursing staff.
2022年2月から国の補助金や診療報酬を財源とした看護職員の賃金の引き上げが図られました。
And from February 2022, wages for nursing staff were raised using government subsidies and medical fees as a source of funding.
コロナ医療等を担う病院の看護職の賃金が月額おおむね1万2000円アップしました。
Wages for nursing staff for professions at hospitals providing medical services, including COVID-19 care, increased by approximately 12,000 yen per month.
さらに2022年11月には国家公務員である医療職の俸給表を改正する方向が示されました。
Furthermore, in November 2022, the MHLW indicated its intention to revise the salary schedule or salary table for medical personnel who are national public servants.
12月には看護の専門性と役割に見合った賃金体系の導入に向けて、厚生労働省から全国の医療関係機関に通知されるなど、看護職の賃金を上げる施策が推進されています。
And in December, the MHLW Health Ministry notified medical institutions nationwide to introduce a wage system commensurate with nursing expertise and roles, and other measures to raise wages for nursing personnel or professions are being promoted.
これは SDNM が掲げる雇用の面からもサービス提供の強化の面からも大きな第一歩であったと考えています。
We believe that this was a major first step in terms of strengthening the SDNM's commitment to both employment and service delivery.
私たち職能団体は、今回の成果を看護の専門職としてのブランディングと次世代の能力の高い人材の獲得につなげていかなければなりません。
We as professional association must link this achievement to the branding of nursing as a profession and to attracting the next generation of highly competent personnel.
また、日本看護協会は看護基礎教育の拡充についても長年取り組んできました。
The Japan Nursing Association has also been working for many years on expanding basic nursing education.
日本には看護師資格を取得するためのルートが様々あり、このことが質の高い看護職の育成に対する課題にもなっています。
There are many different routes to qualify as a nurse in Japan, and this has also posed a challenge with respect to fostering a high-quality nursing professions or practitioners.
そのような中、この春の看護課程卒業者は、大学卒業者が最も多くなりました。
Against this backdrop, university graduates made up the largest number of nursing program graduates this spring for the first time.
看護師志願者の大学志向が主流になりつつあることは、SDNM が掲げる教育とリーダーシップに直結します。
The fact that more and more nursing applicants are choosing to go to college or university is directly related to the SDNM's commitment to education and leadership.
日本看護協会は、これからの社会保健医療ニーズに対応できる看護師を育成できるような看護師教育の実現に一層注力してまいります。
Japan Nursing Association will further be committed to realizing a nursing education to foster nurses who can meet the future social and healthcare needs of society.
以上でございます。時間をいただきましてありがとうございました。
That is all for me. Thank you for your time.
Thank you very much, Dr. Fukui. It's exciting to hear about the progress that you have made in addressing some of the
進
recommendations.
捗いくつか提言ですね。やはり看護師、助産師業界のさまざまな提言が施策に反映されている。そして賃金を上げるのにも
long-term goal, but that it will continue to help as you not only are attracting more individuals, but certainly retaining them. Similarly, the expansion of your nursing programs, you need to be congratulated as you have more university graduates. And again, that standardization and rising of the standards worldwide is part of what we saw not only in the strategic directions, but even before that, the State of the World's Nursing Report. So congratulations on those successes. And we also recognize that it is tied to being able to keep a sufficient workforce that we know has been diminished in terms of those who are leaving the workplace. So thank you very much. All right, next we'll hear from Abida Yasin. I hope I said that right. She is the Vice President of the Malaysia Nurses Association. Is it Abida or Abida?
Abida.
Abida, welcome, and we welcome your comments.
Okay, thank you, Madam President. I'm Abida from Malaysian Nurses Association. This is a story about Malaysian Nurses Association that we in Malaysia, actually, we have an Employment Act that is formed in 1955. So last year, actually, at the end of last year, our government made an amendment to our Employment Act that is actually related to our nurses who work in the private sector. That is on their labor regulation, laws, working hours, benefits, and leave for the employees. Okay, this is inclusive of our nurses who works in the private sector. That is, they reduce the working hours from 48 hours now per week is to 45 hours a week. Okay, and they also get extension of maternity leave. If now they're only getting 60 days for maternity leave, but they extended it to 98 days maternity leave. And for the paternity leaves for marital male employees, including the nurses, if the wives delivered, they get a paternity leave for 7 days. So that is something that making us happy as a nurse in Malaysia now. Second one is about our recognition from our Ministry of Health Malaysia to our nurses. Actually, our entry level as a registered nurse in Malaysia is at diploma level. But because of the nurse tremendous contribution for combating the COVID-19 last few years, our Ministry of Health now is giving a chance for the nurses who hold a Bachelor of Nursing, 210 posts, to be one of the higher ranking nurse in our Ministry of Health. And we also now getting whoever nurses with the post-basics medical specialty, we are getting an allowance for that now after the COVID-19 pandemic. Okay. We also now, Malaysian Association, we are actually taking a strategic direction to form our Malaysian Nursing Council, which we don't have at the moment, where we want to amend the Malaysian Nursing Act that was formed in 1955 to be amended to a new clause, where we want one of us is the nurse to be one of the policymaker or giving this as one of the decision maker for that any policy related to nursing. So the strategic planning is already been finalized, and we already presented to our Ministry of Health, and to be introduced to the higher level or to the Parliament. That's all from Malaysia, I think. Thank you.
Thank you very much, Abida. Once again, we congratulate you on this political advocacy. We know that it takes time to be able to see new legislation come, amending your Nursing Act. And similarly, the work that you're doing to increase benefits, again, has probably really boosted retention in your nursing workforce. And as you continue your exploration to see how you can continue to increase the education level, again, it sounds like very promising work. So thank you very much. All right, our last speaker is Carrie Nuku, who is with the New Zealand Nurses Association, and her title is Governance Leader. And Carrie is also a member of our Audit and Risk Committee at ICN. So we thank you for that service as well. Carrie?
Kia ora koutou katoa, tēnā koe Pamela Rawa ko Howard. It's greetings from Aotearoa, New Zealand. And first of all, if I wanted to start on, and I wanted to talk about our health reforms. But firstly, I need to acknowledge all the concerns that have been raised tonight around health and safety, around workforce, around ethical recruitment, around the global competition for workforce, are all things that we also are challenged by. But over the past year, we've had some significant transformation in our health system. We are going through and have implemented from July 1st, new health reforms. And these primarily were to eliminate or work towards the elimination of health inequities and social inequities, which of course is one of our SDGs priorities. It was also around improving health coverage, so no longer a postcode benefits, but a wider distribution of healthcare and coverage. There was also systematic change trying to streamline under one umbrella the efficiencies across the sectors. Previously, we had 20 district health boards that worked quite differently, but as a country of 4-5 million people, it's realistic, and COVID showed us that we could do these differently and more effective by working under a smaller or a tighter regime. So with the health reforms, we formed 3 entities. One was the Ministry of Health, which was still political in terms of policy development. The second was a health authority called Te Whatu Ora, and the third was a Māori Health Authority, Te Aka Whai Ora. Now, the importance of this transformation is that it recognised an important feature or fundamental constitutional feature of Aotearoa, which is its treaty commitment to the Indigenous people of Aotearoa. What we'd seen previously in 2019 is the crisis amongst Indigenous people, that is poorer life expectancy, increasing medical misadventure, shorter delays to get access to services, higher incidences of misdiagnosis, mistreatment, and importantly, also since COVID, the disproportionate impact of COVID on Indigenous peoples. In 2019, this was considered to be a humanitarian crisis, the impact that the health system was having on Indigenous population. And a group of brave Indigenous nurses took the government to court. And that sparked a number of things. The recommendation that came from the Waitangi Tribunal, the claim that was made from the nurses that challenged the Crown, was that we needed to develop a system that was responsive to Indigenous people. And that was the start of these cascades of transformations that we're currently seeing. So what it did show is that the voices of nurses collectively challenging government can be positive. So as a consequence of that, we're trying to bed in this new way of doing. NZNO has recognised the importance of representing the Indigenous voice of not just its population, but also of nurses. And one of the issues that we talk not only to the United Nations Permanent Forum of Indigenous Rights in the United Nations in New York City numerous times, but also was captured and articulated concisely in our challenge to the Crown, was that nurses that chose to work with their Indigenous people were paid 25% less than those that chose to work with mainstream services. So this was a fundamental discriminatory practice. And the intention of these new systems is to eliminate the structural discrimination that exists within the system and recognise Indigenous nurses, pay them appropriately with their other colleagues, and to recognise the harm that has been created and the impact that this has had on Indigenous populations. So in line with this, we would like to ask that ICN also recognises the different way that Tōpūtanga Tapuhi Kaitiaki o Aotearoa, the New Zealand Nurses Organisation, works. We have a co-governance operation where we have 2 elected presidents, and one is called the president and one is called the kaiwhakahaere. The kaiwhakahaere and the president have got governance authority across the 56,000 members of this of our membership across the Aotearoa, but the kaiwhakahaere also articulates the vision, views and cultural aspirations of Indigenous people, and would like to call on ICN to recognise that these 2 positions are both presidents within our country, and if we could recognise them equally from ICN, that would help us to embed a different way of doing and to encourage people, especially Indigenous nurses, whom were that they have a right to stand and they have a voice to be had. And this is the forum to ensure that it informs global health. Kia ora.
Thank you very much, Carrie. And again, congratulations to you for achieving these significant transformations, and clearly the work that you're doing to dismantle structural discrimination, as well as really see to the healthcare needs of not only Indigenous peoples, but Indigenous nurses, is really exemplary. So thank you for recognizing the overall issues, but really focusing your sharing with us about the successes that you've had. And we know that New Zealand is one of the countries, and our New Zealand nurses to champion these issues, again, for our Indigenous population. So thank you for that. We will certainly take under advisement and have follow-up conversations with you about how we can help address the concern about the, let me see if I said it right, Kaiwhakahaere president, as well as you. And so we will do our best to follow up to see how we can help honor that as well.
Thank you.
Thank you. Okay. So that concludes our presentations from our NNA leaders. We do have 2 questions that have been entered. And so again, I encourage everyone who's listening that if you have a question, please go ahead and put it in. And why don't we go to the Q&A? The first one is hoping that our Canadian embassies will, especially in Africa, will grant visas to individuals who will be able to, so they will be able to attend the Congress. I am not an expert on the process for permissions, and Howard, I'm going to turn to you to see if you have any specific information, but clearly if anyone is having difficulty, we encourage you to contact ICN and the information that has come forward through registration. So Howard, let me ask if you have any comments.
Thanks very much. So colleagues, firstly, there is information on the website, advice and guidance about applying for visas to enter Canada for the conference. If you are not in a country where you can get one of the electronic visas, and for many of you in your region, you will have to apply for a visa, a visitor's visa to attend the Congress. We strongly urge you to do that, to start that process as soon as possible, because the Canadian You can see from the Canadian website that some of the wait times can run into many days, they advise. Please do not leave the visa application until the month before the Congress. Once you've made the decision and you've registered, as the President has said, early bird registration closes beginning of next week on the 31st. Please start that process straight away. We're working very closely with the Canadian Nurses Association. There are letters of support that are available as well, to be clear, the reason for the visit and the purpose for Congress as well. But the advice is apply early. Thanks.
Thank you, Howard. Okay, we're going to go to our next question. I think everybody can see the Q&A. So the question really is pointing out that there are some actual benefits of being able to legislate nurse to patient ratios. As many of you do know, though, it is a relatively controversial option in some countries. But the question is, if we know that this is helpful for recruiting and retaining nurses, and it is helpful to provide better safety in the environment for nurses and patients, then how could we bring this to discussion to create a global phenomenon? And I would say two things, which is we will certainly encourage the dialogue around how do we help countries who want to address this kind of legislation. Again, you're coming from a country that has only one of our 50 states plus territories has actually achieved that legislation. And again, it's remained controversial for 30 years. That the bottom line recommendation is to enact whatever you can to work on, whether it's the resources or the policies or joint decision-making, to have the important number of nurses that you need. So to be able to try to quantify what do those ratios look like, or what does your staffing pattern need to look like in any setting for any country, and to be able to advocate for the highest number of nurses that you think you need. And for those who want to pursue the legislative route, again, knowing it is a relatively long-term process for most areas, but we continue to and can commit to, again, soliciting that input and dialogue around who has been able to implement any kinds of staffing ratios, and determine in conversation with our colleagues. This would probably be a good discussion to have perhaps with colleagues when you're at the CNR meeting, to find out, again, who is actually engaged in that kind of work. And again, Howard, I would ask you or David if either of you have any comments about the workforce strategy.
Thanks very much for the question. Just to point you to some resources that do exist from ICN. We have a safe staffing position statement. It was revised in the last 2 or 3 years, relatively recently. It sets out the case for the evidence, the importance of having systems in place to ensure safe staffing levels, and it describes some of the approaches that can be taken. Because the context of each country differs so markedly, we cannot, in a global position statement, put forward one model. That's something for countries to work out what's most appropriate to their needs. But we are very, very clear about the importance of having systems and mechanisms in place that are enforceable to guarantee safe staffing levels. Secondly, there is a white paper that we produced with one of the global patient safety centers, which digs much more into the evidence and the approaches of different countries. So if you want to actually see the details of what some countries are doing, it's in that white paper. And thirdly, we advocated and were successful that for a recent World Patient Safety Day that WHO lead, they focused on health worker safety as well as patient safety, and we had included the importance of safe staffing levels in that document. And the next global ministerial meeting summit that's happening in Switzerland later this year on patient safety, ICN have been asked to contribute to that from a workforce perspective. So there's quite a lot of resources and materials that are out there. And Dave, I know, Dave, if you want to say something else, please do. But I know you'll be very happy to connect with associations in the region to discuss this through some more and make sure they've got the access to the resources that we have.
And I would ask Dave, if you happen to know, are there any Congress sessions, policy cafes, or other that are going to be focused on staffing strategies and safe staffing? To Anne's question, you know, there's actually a lot of Congress that's already programmed, and so there may not be a targeted opportunity, but let me ask you to go ahead and comment.
Yeah, thank you very much for that. In regards to sessions at Congress, we are working closely with Neelam, who is the Director of Patient Safety at the World Health Organization, and we are having a session on patient safety, particularly what we learned when health systems were under stretch during the pandemic, and also around safe staffing. Yes, there will be a dedicated session just on that and learning from in-country examples. Just to add to Howard's comments just from before, many of you may not have picked up the paper that was actually that he referred to in regards to workforce, but safe staffing often refers to just the acute care sector. When they looked at that model about staffing shortages and they said the 30 million mark, they actually looked at the entire sector and saying, this is what you actually need to deliver safe care, a minimum number per 10,000 people in these various sectors, including long-term prevention, promotion, primary and acute care sector. So I think that's also a really worthwhile argument coming up with, because it demonstrates the value of trying to achieve safe services in multi-areas as well. So I think, Howard, we've sent that around already, that document, but it's also just to make sure we've had a look at it as well.
Thanks, Dave. And again, to Anne's last comment, we will see if there's an opportunity for some kind of dialogue at Congress or even within the CNR meeting. Again, I don't know that we have that opportunity right now, but you know, clearly there will be many individuals that are focusing on workforce, on numbers, on staffing models, on innovation, in order to be able to not only provide the care that we know has been compromised with workforce changes, but also, again, the issue of safety and patient outcomes related to safety. So thanks for that comment. Are there other questions or comments that anyone would like to put into the Q&A? Let me ask any of our panelists, is there anyone who would like to make a follow-up to any of the questions that you've heard? Let's see, I saw one hand go up. Alisi?
President?
Yes.
Yeah, I just wanted to comment on the legislation of patient staff ratio, and from this part of the Pacific, from our region. Sorry, I'm sort of leaning towards the legislation because it's you know, it's probably the only way to guarantee safety, guarantee the retention of staff, and also the retention of skills, because we are not only talking about the numbers, the staff and the patient, but we must also remember that in our part of the world, most of our hospitals are running on very, very junior nurses. New graduates are making the numbers for that staffing ratio. And the skills levels are very poor, very unsafe for our people, our patients. So, I mean, for us in this part of the world, I believe that we probably need to have that legislated and ensure that we also have the skills level included in the legislation because of that, the risk that just looking at the patient staff ratio can bring to our fore. And that's what we are experiencing right now. No amount of advocacy meetings, literature, and discussion would change anything in the Pacific right now. Yeah, that's what I wanted to share, and I hope that that ICN can take it in when we have our discussions at the CNR or in the Congress. Thank you.
Thank you, Elise. Yeah, we'll figure out how we can continue to advance this issue, and perhaps we could see if NNAs can share information so that we also again know what other regions, because I think there are many who are in that same situation of being reliant on new nurse graduates, which we know is not ideal. The loss of those senior nurses coming out of countries that cannot afford to lose them really is problematic. Howard, please come in.
Just one other brief point that occurs to me as I hear people talking about this. I mentioned the issue of strikes and disputes that we're seeing in a number of regions. And of course, our associations where that happens also then negotiate with employers and with government to ensure that on strike days, there are minimum emergency safe levels of staffing ensured and provided on those days. And indeed, in the ICN strike policy statement, we recommend that happens as well. What we have been hearing anecdotally is that some of those staffing levels for strike day, which is supposed to be the emergency cover, are close to similar or even the same as normal staffing. That's anecdotal evidence, but just to reinforce your point, Madam President, if folk have got recent examples that they could send to us, that could be quite powerful for us to add in terms of the inadequacy of normal staffing levels.
Yes, thank you. Okay, well, we are nearing. Oops, we have Dr. Fukui, did you want to say something? And then we'll be doing our wrap up. I think I saw your hand briefly.
はい、ありがとうございます。日本では高齢の入院患者さんが増えていて、看護師の対応が難しくなっています。
So yes, thank you very much for allowing me to speak. In Japan, we are seeing an increase in the number of senior patients getting hospitalized. And so we are starting to see a shortage of nurses to care for these elderly patients in the hospital.
そのことへの対応として ICT などを活用しています。
And so in order to help lessen the burden, we are leveraging ICT.
またロボットの導入も進んでいます。
We are also seeing an increase in the introduction of robots in the hospitals.
看護職の人数を増やしていくことは財源の観点からも難しい状況があります。
And actually, from a financial standpoint, it is difficult to increase the number of nurses.
テクノロジーを活用した看護をどう開発していくかということもこれからの大きな課題だと思います。
So I believe a major challenge going forwards in the future would be how we can leverage technology in nursing.
そして高齢者は複雑で多様な病態を持っています。
Also, elderly patients have very complex and complicated disease states.
その状況に対応していくためには、皆様が述べられておられるように、看護の実践力を上げていく必要があります。
And so to cater to their diverse needs, as everyone has pointed out, we really need to improve the nurses' capability to really handle things in the field.
ベッドサイドケアがさらにより良くなっていくように、仕組みを整えていくことが必要だと思っています。
So I believe it is important that we put into place mechanism that will help improve bedside care.
ありがとうございました。
Thank you.
Thank you very much. And I'm in awe of some of the technology advances that you've been able to do. The Japan Nurses Association and nurses throughout Japan are really great exemplars. And I also encourage everyone to go back to the BBC Storyworks, Caring with Courage, that Howard mentioned. And there's a great example from Japan of using technology, particularly in the care of elders, to anticipate, when they're getting into trouble and be able to then intervene to understand when someone is beginning to show instability or mobility problems or even advancing dementia. So thank you for raising that issue, which is really important. Okay, Howard, I'm going to go to you and ask for your comments in terms of summing up where we are and any next steps.
Thanks very much, Madam President. Thanks everyone for your time and for your participation. One of the things that I've just been struck by the conversation is the examples of progress and innovation that colleagues are making. As we all know, it can, we can look at the world and what's ahead of us and the uncertainty and the challenges, and it can feel quite overwhelming. Our BBC project is to help us to see solutions and positives, but your interventions, your comments this morning have really reinforced that again. And we want to collect and to bring that work forward. The IND, as the President has said, the International Nurses Day theme for this year, our intention is to run it for longer than just the day. For 12 months, for possibly for longer. And you heard, we will be calling it a manifesto, and it will include those key elements, not just to strengthen and improve the nursing workforce, but what we want to see happen with our health systems as well. I know many of you will also be joining us in Bangkok at the beginning of March. We have the Asia Workforce Forum. That will be a great opportunity for us to get into more detail of some of the issues that have come up here. And I know that as well as the colleagues from your region, there'll be colleagues from the CRO region who'll be meeting then as well. So I very much look forward to continuing the discussion in the coming weeks with you all. And thank you again for your contributions today.
Thank you, Howard. And I'm going to end with a thank you as well. We appreciate you not only taking the time to for our panelists who prepared remarks, but those who have been listening in and all the work that's been done during the last year. And I know as was written into the Q&A, yes, we are trying to be very action oriented. And sometimes that is challenging, again, bringing everyone together and being able to go beyond issuing documents to really demonstrating the implementation and the actions that we're taking. But that's really our charge and what we're committed to this coming year, whether it's specific to some of the direct workforce issues, and there will be work coming out, whether it's our strategic directions for nursing and midwifery and some of the other areas, our continued pressing on governments to increase their funding and resources for nursing. So this is a time that we do appreciate, again, being able to be in close touch with you so that we understand what's happening on the ground in your countries, also the very specific efforts and initiatives that you're undertaking, because you're in the best position to influence your ministers of health, finance, social services, and your prime minister. So we want to be able to help you in those efforts as well. So thank you. We will look forward to the follow-up. I appreciate everyone who was able to join us today. And again, wish everyone a happy New Year and happy Lunar New Year. So thank you so much. Bye-bye.